Chapter 6, Anatomy and Physiology. Second to last chapter this week. Close up our week 1. This chapter goes really well hand in hand with chapter 5, the medical terminology chapter. How we look at the body systems, how we study the body systems. It all kind of is intertwined with medical terminology, right? The two go hand in hand. So body systems. So this is a very quick overview of essentially all the different body systems. Keep in mind that this is the first time that we're looking at them, but this isn't the only time that we're looking at the body systems. In fact, most of these systems have their own chapters where we dive a little bit deeper into them throughout the course. So yes, study this, get familiar with what is in each system, but try not to feel too overwhelmed with getting this all thrown at you, because like I said, we do go through it a little bit slower and study each system individually later on. So the musculoskeletal system has 3 main functions. It gives the body shape, it protects all of our vital organs, and it provides structure for body movement. The skeleton is a huge part of the musculoskeletal system. It consists of the skull, spine, ribs, sternum, essentially all of our bones within our skeleton. So our skull is the bony structure of the head. The face is actually considered to be different bones. There's actually a bunch of little tiny bones that make up our face. Our mandible is the top portion of our teeth, or what our teeth connect into. Or excuse me, that's our maxilla. Our mandible is the lower jaw that moves. We've got a whole bunch of different nasal bones. Our orbits, or where our eye sockets are, our zygomatic arches would be our cheekbones. So all of these little bones are actually fused together to create the skull. So if you look here on this image, you can see that there are what we call suture lines, and it's where 2 bones connect. When we are born, our bones are not connected within our skull. It actually allows our skull is flexible at that point so that we can pass through the birth canal without completely destroying our mother. So those suture lines are where the bones eventually form together. So if you've ever heard of a soft spot before on a baby, typically the biggest soft spot is right on the top of the head. That's where the parietal bone and the frontal bone are going to fuse here and make this suture line, but it's flexible to be born. The spinal column is consisting of 33 vertebrae that encase the spinal cord, and the spinal cord is essential for movement, sensation, all of our vital functions. Our thoracic cavity consists of 12 ribs and a sternum. It protects the heart, lungs, vital structures, our aorta, are all within that thoracic cavity. You can see that it's broken up into sections. This is a little bit easier for us to kind of talk about each individual spinal process. So instead of saying, oh, I broke my 17th vertebrae, you can say instead, I broke my, T4, or lumbar actually would, or T11, whatever it is. Anyways. It's just a little bit more specific. And each of those vertebrae, because they're carrying a different amount of weight, depending on where they're at, whether it's cervical, thoracic, or lumbar, does dictate the structure of the vertebrae slightly. They do change slightly. Then we've got our pelvis, which is formed up of several different bones. We've got the ilium, the ischium, pubis, hip joints, etc. All kind of form our pelvis. Lower extremities, femur, patella, tib, fib, ankle. In our ankle, we've got, I believe, 7 or 8 different bones. Our foot is made up of several different bones as well. We've got metatarsals, our heel, our toe bones. And then our upper extremities are organized very similarly in comparison to our legs. The upper portion of our arm, we've got 1 bone. The lower portion of our arm, we've got 2. Same thing with our legs. We've got 1 bone in the upper portion of our leg, 2 bones in the lower portion. Our ankles and wrists are very similar as well. They are both consisting of several bones to allow for movement. Our fingers have bones as well as our hand. So here's an image of our skeletal system. There's also cartilage that's kind of thrown in here to kind of keep things together and have some cushion in those joints. Our joints are classified basically any place that there are bones connecting to other bones. And there's several different types, or two different types of main joints. We've got our ball and socket and our hinge joints. And then we've got muscles, which would be the other half of the musculoskeletal system. Muscles like voluntary muscles or skeletal muscles help us move our skeleton. They help us to pick things up. They help us to lift weights, right? Those are the ones that we try and work out so we look nice and fit for the summer. Our involuntary muscles are also called smooth muscles. This is what lines most of our organs. They're involuntary. We don't have to think about those muscles moving. They just do. So when we eat food, we don't have to think about digesting it. The musculature just does. Cardiac muscle is very interesting. I'm kind of a cardiac nerd. I absolutely love learning about the heart. Cardiac muscle is the only muscle within your entire body that has its own automaticity, which means that not only does it just function, we don't have to think about it functioning, and we can do this really cool thing where we put leads on people's chests to see the electrical function of the heart just going, right? It's a way to kind of read what's happening in the heart. It's very cool. We can't do that with any of our other muscles. Yes, there are electrical impulses, but it's not automatic. We have to tell our muscles to create this impulse. Or we can externally input electrical activity into the muscles to like make them twitch and things like that. Our respiratory system brings oxygen into the body via inhalation and excretes carbon dioxide via exhalation. Air enters the body through the mouth and the nose and moves through the respiratory system, including locations like the oropharynx, nasopharynx, epiglottis, larynx, trachea, lungs. The diaphragm is included in this as well. The diaphragm is actually the muscle that helps us to breathe. Contraction and relaxation of the diaphragm is what creates the ability to bring air into our lungs and expel air. Again, we're going to go through these systems individually later on, so I won't go too in depth with any of them. Inhalation is an active process. Diaphragm and intercostal muscles, which are the muscles in between your ribs, contract. The diaphragm then kind of flattens out or moves downwards, and the ribs move upwards and outwards. It's negative pressure, the creation of negative pressure, that pulls air into the lungs. So if you all take a deep breath, it's actually the muscle that's causing us to breathe in as opposed to anything else, I guess. Exhalation is a passive process. So we just took a deep breath. Hopefully you guys already let it out. But if you do it again and let it out, it's the relaxation of those muscles that allows us to push the air back out using positive pressure. Ventilation and respiration, we tend to get mixed up quite a lot. Ventilation is the movement of gases to and from the alveoli, and respiration is the actual exchange of gases between the cells and the bloodstream. So if we were to just take a set of lungs, right? If we just had just a set of lungs, no body attached to it, just a set of lungs, and we pushed air in and out of those lungs, we have ventilation. We are ventilating those lungs. But it's not really doing us any good, right? Because there's not a person attached to it. Now, say we take any one of us and we decide to ventilate, where we're pushing air into the lungs. Hopefully, respiration is happening as well, where we have oxygen going in, going through the membranes into our bloodstream, carbon dioxide getting exchanged, coming out into our lungs, and then us exhaling our waste, essentially, the carbon dioxide, right? So hopefully respiration is happening anytime we are ventilating our patients. Anytime a patient is breathing in, we're hoping that respiration is happening. And there's a lot of different things that can cause it to not happen. Things like asthma, COPD. All of those things can affect the way that gases are exchanged at the cellular level. Oxygenated blood is carried from the lungs to the heart and then is pumped out through the rest of the body. And then at the cellular level, oxygen is exchanged with the cells for waste of carbon dioxide, and the deoxygenated blood returns to the heart. So it's that exchange of oxygen and carbon dioxide that really keeps our body in a nice balance. We talk about pH level just a little bit in this particular class, but our body has a normal pH level. It's nice and balanced. When we bring oxygen in or release carbon dioxide, it's balancing that pH level. So if our body is too acidic, typically, not always, but typically there's an imbalance between the oxygen and the carbon dioxide exchange. Deoxygenated blood then returns to the heart, and then lungs exchange waste with carbon dioxide and oxygen. So it's a wonderful little circle. Kids' airways are different than adult airways. Obviously, the structures are similar, but they're a lot smaller. They're also not as rigid. So say if someone gets hit in the neck, has any sort of neck trauma, if they're a child, it's more likely that they have damaged the cartilage within their tracheal structures, as opposed to an adult where they have a more rigid airway. It's also more likely that kids are going to get food stuck in their throat or foreign objects stuck in their throat when they're swallowing. Their tongues are also proportionately larger than adults, so it's more easily obstructing the airway. Cardiovascular system is made up of 3 different components. We've got the heart, blood, and blood vessels. There are 4 different chambers to the heart. We've got 2 atria, which are at the top of the heart, and then we've got 2 ventricles, which are the lower portion of the heart. The pathway of blood through the heart isn't important for us right now. We will talk about it when we get into this a little bit more in depth. But you can see here how things are structured. We've got veins coming into the atrium, blood getting pumped into the atrium, out into the lungs, coming back into the heart, and then getting pumped out through the ventricles, through the aorta, and the rest of the body. There's an electrical conduction that happens, like I mentioned before. The heart has its own automaticity, and when we place electrical leads around the heart on the chest, we can see exactly the pathway of electrical activity. Now, if there's any sort of issue with that electrical activity, we can pinpoint exactly where there's a problem. If everything looks nice and correct, the electrical activity starts in the sinoatrial node, moves into the AV node, and then down into these bundle branches where we have contraction of the ventricles. There are several arteries that are incredibly important for us to know the names of. Coronary arteries feed the heart with its own blood supply. So oftentimes when people have heart attacks, it's happening in those coronary arteries. The aorta is the largest blood vessel throughout your body. It is the main one that goes from your heart down through the rest of your body. You have pulmonary arteries, which go into the lungs, carotid arteries, which are up in the neck, and then femoral arteries, which are down by your pelvis. The brachial artery is in the bicep, and the radial artery is on the thumb side of your wrist. You also have an ulnar pulse or an ulnar artery that runs on the pinky finger side of your wrist. And then we have dorsal tibial arteries, which is in the back of the knee, and then dorsalis pedis arteries, which are in the feet. So at all of those points, you should be able to feel a pulse. Now, that being said, aorta and pulmonary and coronary, those first 3, we don't have the ability to physically feel a pulse with those. If you feel a pulse in the other places, those 3 are working appropriately. So to check the carotid artery, that's in the side of your neck. You just kind of roll over, find the midline of your neck, and then roll over to one side or the other. We use 2 fingers to check a pulse. Sometimes it's helpful to kind of find the spot and then slowly push in, and then you should be able to feel a pulse there. The next one is your femoral artery. This one can be a little difficult to find on other people. If you find right where your leg kind of meets your hips, right in that crease, your femoral artery should be right in there. So you do have to push a little bit harder for that one, but you should be able to find it. Brachial artery, this one we use a lot on kids, especially infants. It's a lot easier to find this artery on infants. You should still be able to find it on an adult though. So if you're following along with me, you go to the bicep, kind of find where the most of the musculature is, kind of roll down to the side, and then right in that soft spot, if you kind of push, you should be able to feel the artery. Like I said, that one's a little bit harder to find on adults. We use that a lot in infants. Radial artery is pretty easy to find. This is the one that we use most commonly for alert and oriented patients. Go to the thumb side of your wrist, again using 2 fingers, and we're going to slightly push. Make sure that your wrist is relaxed. If you're having a hard time finding it, you should be able to kind of make a fist with that hand and curl upwards. There's a little tendon that might pop out right there. If you put your fingers on that tendon and then roll over to the side, there's a nice soft squishy place right there. That's where you want to go to check that pulse. Posterior tibial, it can be really difficult to find as well. I'm not as good at this one. It's in the back of the knee, so you kind of have to play around a little bit in those soft spots there and push to see if you can find it. Dorsalis pedis is on the top of the foot. This should be kind of right on the very top of your foot, just laterally to the big toe, on those metatarsals, so on the main body of your foot, and it should be there. Anytime you find a pulse where it's questionable as to whether or not, like if there's, say, a broken arm and you find the radial pulse, typically we would make like a little X over the pulse point. We do that a lot on the feet, just to make sure that other providers know that we in fact found a pulse. It was right here. X marks the spot, so that they hopefully can find it as well. Circulation of blood. So our circulatory system is a giant circle, thus the name. Our blood goes from our heart into arteries. Those arteries thin into arterioles, which are smaller, and then they go into capillary beds. Those capillary beds are the smallest vessel in our body. They're like 1 blood cell length or diameter, I guess. It's capillary bleeding that we most commonly experience. So if you've ever gotten a cat scratch or skinned your knee, usually it's capillary bleeding that we have there. From there, those capillary beds widen out into venules and then into veins. So they get bigger and bigger into veins. Blood is made up of a few different things. We've got plasma, red blood cells, white blood cells, and platelets. Each different component has its own kind of job to do within the blood. Platelets help with clotting. White blood cells help with fighting infections. Red blood cells help us to carry oxygen. And then plasma helps to give our blood a little bit more volume so it can actually circulate. Pulse refers to the pressure wave of blood flowing down the artery when the left ventricle contracts. So when our heart actually pushes out blood throughout our body, we should be able to feel it. So it's a fast enough pulse that if you were to take a pulse at your wrist and at your foot, it should feel almost identical. There might be a slight delay, but it should feel pretty identical. Pulses can usually be felt when you're compressing an artery over a bone. You can find pulses in a lot of different places throughout the body. The ones that we just found are the most common ones for us to look at. Peripheral pulse means any pulse point that's on the outside of the body. So central pulse would be like our carotid, our femoral. If we were able to feel like an aortic pulse, that would be a central. Peripheral pulses are anything on our arms and legs. So as our blood pressure gets lower and lower, the less likely we are to feel a pulse, the farther away from the heart. So if we've got, say, a really weak heart and our blood pressure is just really low, our heart is not pumping too hard, we probably won't have a pulse at the hands and feet because our blood just can't get there. Our heart doesn't have enough strength to get there. But we probably have a pulse at the neck, the carotid arteries. So that's why if we have any unresponsive patients, we're going to go straight to the carotid artery. If there's not a pulse there, it means that their brain is not perfusing, and we would start CPR. Blood pressure is the force of blood exerted against the walls of the blood vessels. We do get two different readings when we look at blood pressures. We get the systolic reading, which is the upper reading, the one on top, and the diastolic one is the one on the bottom. Each kind of looks at different things. You should have a pretty decent gap between the two numbers. If the numbers are the same, that would be very bad. I've never actually seen that. But the closer that they get, typically the higher the blood pressure is going to be. Perfusion refers to the adequate supply of oxygen and nutrients to the cells with the removal of waste products. If we don't have perfusion, we call it hypoperfusion, low perfusion. This is where we start to experience shock-like symptoms, and we'll go through that in our shock lecture. The lymphatic systems, its function is to capture fluid and maintain the balance within our system. So it's made up of a lot of different kind of glands. We've got adenoids, tonsils, spleen, thymus, and a few different nodes. Big thing with this one is that if a patient has had a mastectomy, we don't want to do a blood pressure on that side. It can cause some damage, so we don't want to do that. Nervous system is made up of our central and peripheral nervous and our autonomic nervous systems. Central nervous system is our brain and our spinal cord, and then our peripheral nervous system is sensory nerves and motor nerves. Autonomic would be all of our involuntary motor functions. So auto, think of it just going automatically. Peripheral nervous systems are what is in charge of kind of feeling different textures and helping us to move our muscles so that we can pick things up. Digestive system provides mechanisms by which food travels through the body and is digested and processed, and the nutrients is given out through the rest of our body. So this would be the stomach, large intestine, small intestine, and then there's a few other accessory organs that kind of help with the breakdown of food. So we've got our liver, gallbladder, spleen, pancreas, and appendix. Our integumentary system, its job is to protect the body, balance water, temperature regulation, excretion, and impact absorption. So the integumentary system consists of our skin. The layers of the skin are epidermis, dermis, and subcutaneous layers, and within each layer there are different structures. For this class, you don't need to know the different structures and where they lie. For instance, if I were to say, oh, where are the hair follicles located, the base of the hair follicles, I wouldn't expect you to know that it's in the dermis, right? I do want you guys to know the difference between epidermis, dermis, and subcutaneous layer. When we start talking about burns, it comes in handy, and in our trauma lectures, it comes in handy to know where those different layers of the skin are located. The endocrine system, this produces hormones that regulate body activity and functions. So pancreas, adrenal glands, those secrete epinephrine. The endocrine system, we've got a few different organs that are a part of that. All of our reproductive organs are a part of it as well. Renal system, also called the urinary system. This helps us to regulate all the fluids and chemicals in our body. We tend to put a lot of crap, for lack of a better word, in our body. Things like alcohol, drugs, recreational or prescription, and it's through the renal system more often than not that our body kind of processes these. Now, it can also be processed in your liver and a few other organs as well. But our kidneys tend to take the hit oftentimes. Our bladder is what kind of holds all of the urine until we are ready for it to be excreted. So we've got kidneys, bladders, urethra, and ureters that are all a part of this renal system. Urethra is used to excrete the urine from the bladder to the external environment. Closely tied in, we have the reproductive system. Our male reproductive system is primarily external, and our female reproductive system is primarily internal. Note, big thing within the difference between men and women is when it comes to our urinary system, women are more susceptible to UTIs because the urethras are significantly shorter in women as opposed to men. Female reproductive system, generalized rule of thumb when we are trying to treat patients that are biologically female, anywhere from 8 years old to 80, we want to ask about last known menstrual cycle, sexual activity, things like that. I know it seems kind of extreme when we talk about it, 8 to 80. Everyone's a little bit different. So we just try to cover all of our bases, right? We don't want to assume anything and then miss something big, right? All right. I will see you in chapter 13.